Hey guys, so today is Friday in March 2012. I'm just going to talk a little bit about surgery, or my surgery. Um, I had a video up or something, I can't remember, but it's not there anymore. I apologise if it's really quiet, so you may have to turn the volume up or whatever. Alright, so for my surgery, I had it done in January 2011, I believe. I can't remember exactly. About 17th of January 2011, I think the date was. I had it done here in Queensland, Australia. Um, my surgeon was Hugh Bartholomew's, and I had it done at the Ipswich um, private hospital, I think it is, or the general hospital, whatever. It was about a 2 hour procedure, I think. Well, I assume that's what I was told I was under, so yeah. um, I'm going to talk a little bit quickly about what I know about the surgeon and his sort of procedure. The procedure he does is a line. He goes around the nipple, then a line, and then he goes to the next one. Well, he doesn't do that or whatever. Then the same thing on the other side. He doesn't remove the nipple and graft it and do the line under the chest, like the pec line or whatever. He does it like that. And I think his goal in doing that is he's keeping as much of the sensation and all of that as possible. And with me, that was successful. I'm sure that it may be unsuccessful for other people, and I'm sure that there's been some people where it's been unsuccessful. He's been operating on trans dudes for a number of years, and he does train other surgeons in this country on how to do the procedure, if that's what they want to do. I know that recently he's just about finished training a South Australian surgeon on how to do this particular procedure. So yeah, Bartholomew's, some people have said that he's not very well bed mannered or whatever. Sorry, my hair's doing something, I'm not sure. And this whole mirror image thing's fucking with me. He seemed, when I first saw him, the reason I chose him was he was honest to me. He gave me all the information I needed for my surgery. I didn't really have any questions to ask him. My biggest thing was a surgeon that was honest and passionate. I didn't give a fuck really about his bedside manner or anything like that. He treated me as a human being with the history I have. So he just treated me like any other male, and not once did he ever fuck up. The only thing that he ever did say was that he thinks it's sorry, he can't imagine what it's like to be in this situation that we're in. Sorry, I had another camera in seeing if that helped with the whole sound thing, but it didn't even pick it up. So yeah, in my experience with Hugh Bartholomew's, it has been extremely positive. And I'm a huge advocate for that simply because of my experience. However, I know that some people have had negative experiences, and that's unfortunate, and I'm sorry that that's happened to them. He did make it clear to me that he specialises, or his technique is he's much more confident with small chested guys. What he said was a large A, small B. Not even that, I don't think. Like, I don't know about bra sizes. I didn't wear them. That's all I can say. Sorry up for like 5 minutes, so I've got to make this quick. So yeah, I was relatively small, and I have got a pre-T picture I have shown to some people. And yeah, maybe I'll show it publicly one day closed for him or whatever. I'm not sure. Um, so yeah, I'll show you my chest. Now with my chest, so this is it. So as you can see, I'm quite hairy. So with the scarring, oh, with the scarring, you can still slightly see it. It goes across, and it goes around my nipple, and then across again. And that's on both sides, if you can see it, I don't know. So yeah, for 12 months, I think personally, it's pretty damn good, given I have full nipple sensation. Um, I've got all my feeling. Um, my nipples react to hot and cold, so on and so forth. So yeah, I've got full sensation, full feeling. The only downfall that I have, and it's just stupid little things, and I mean that's just me being vain, and I'm not worrying about a second surgery, simply because I don't really need it. But if I do what the surgeon said, it's build up my chest muscles, my pec muscles, it'll take some of that issue away. And that is, I have got small dints. So if you can't really see it on the picture, maybe there, oh, this side. So there's a slight dint there. It's more prevalent in public, like in person. The same with there. There's a slight dent, but that is only from where he's removed the breast tissue. I don't think he did lipo. I don't think he does lipo. And obviously I've got some fat there, and it's a fat pocket kind of thing. So yeah, if I build up my pec muscles and drop some body fat, which is what I've just recently started doing, going to the gym, and as you can tell, like, I'm not buff, or I didn't work out prior to surgery, and so on and so forth. I've got a shoulder injury which I've been dealing with for a few years, so yeah, it's been whatever. Yeah, so they're my real issues. And the only other huge issue, I can't remember which nipple it is one of the nipples, the areola part underneath, is a bit larger than the other, and it's a bit stretched. Like, but that's just small little stupid things, like, in the whole picture for me. Firstly, I don't ever wear a shirt. Like, I'm not out for the most part where I live, and I've had my shirt off around people, including girls that I may be dating or just met and been friends with them. I never wear a shirt, and no one's ever noticed the scarring. And if they have, like, they haven't said anything. People don't really look there. I don't know. Same with, I've been around dudes. Same thing. Been public pools, the beach. No one asks questions. No one says anything. I don't really think anybody notices, and if they do, they don't really care. I think it's because I'm confident enough to just take my shirt off, do whatever. I don't give a fuck. Mostly because it's so hot here, and I struggle with heat. I perspire a lot, all over my body. So yeah, I don't. Sorry. I don't really care for the most part. Like I said, I've got those few little issues that I'm very vain about. Well, not even really. Like, they're trivial things, I suppose. Like, some people would care and others don't. And I guess for me, I recognise the fact that I'm so privileged for the fact that I was able to have my surgery. And there's people that can't have hormones or food or whatever. And I was able to have my chest surgery. In saying that, for chest surgery, I had a positive experience. On the other side, I'm not privately insured. I don't have private insurance or whatever. I, for medical reasons, need a hysterectomy. Mostly because of cancer. I haven't got cancer yet, but cancer is quite severe in my family. And given I'm on testosterone treatment for my gender shit, um, cancer is a real issue for my future. It's a real thing. So I tried to get a hysterectomy via the public health system, and I was flat out discriminated against, which is fine. It's not fine. Um, their wording was professional, but it was because of my trans status that they rejected that, not because of my medical history or my medical future. It was because I'm trans. I'm not fighting that because I also recognise that there are women that live with quite severe issues down there, and at this point in my life, I'm not facing cancer, so it's not life-threatening reasons for me to have that operation. And if some people have any sort of understanding of Queensland health system, especially the public Queensland health system, it's a bit fucked up, to put it politely. Even to go into emergency, you could be. My grandma went in there one day. She waited for 7 hours, and it's just disgusting. Like, she's got a severe lung disease. Um, she had she was a guinea pig a few years ago. She had 70% of her lungs removed and replaced with a glue. And when she gets sick, she needs emergency treatment right then and there. And she went to our local hospital, and she had to wait for 7 hours. She couldn't breathe, and she nearly died in the waiting room. It wasn't until my grandfather really became quite aggressive, which is disgusting that he had to become aggressive because he's not an aggressive person by nature. Well, since he's on this treatment for his cancer, he's on estrogen injections for cancer. He's got prostate and bowel cancer, but he's only alive because he's on estrogen injections essentially. So yeah, since he's been on that, he's not an aggressive person by nature. But it was 7 hours of him watching his life partner and his best friend getting closer and closer to death that he then had to become verbally aggressive to get her seen by a nurse. So yeah, the Queensland health system sucks. So yeah, that was an unfortunate event. I'm coming up to 13 minutes, so I just want to wrap it up. For my chest surgery, I saw Hugh Bartholomew's in Queensland, Australia. I saw him at the Ipswich office, and then I was operated in the Ipswich because it's only a day surgery. You don't have to spend the night, so it's cheaper overall. Insurance is really funny with him. You'd have to speak to him, or contact me privately, and I can talk to you a bit about what I know. My operation costed approximately $9,000 all up. About 1,500, if that, was given back to me via Medicare. By $9,000, I think it was about $9,000. That covered my anaesthetic costs, my hospital stay for the operation. You're paying for two surgeons because he always trains another surgeon, and etc. etc. Cost may increase, I'm not sure, but that's what it was when I had mine done. So yeah, my experience was positive. I saw him 4 times throughout the last year, for checkups and such. 4 times? 3 or 4 times. Maybe less. I can't remember now. And any issues I had, I spoke to him or his staff about. I brought them up straight away with him or her or whoever that I was seeing. I'm going to stop this because I'm going to continue on about the scar treatments that I went through. So I'll be back. Just, yeah.